Hello students, welcome back to my channel. In this video, we will learn about anatomy of urinary system. Introduction. The body takes the nutrients from food and converts them to energy. After the body has taken the food components that is needed, waste products are left behind the bowel and in the blood. The kidney and the urinary system help the body to eliminate liquid waste called urea and to keep chemicals such as potassium and sodium and water in balance. Urea is carried in the bloodstream to the kidneys where it is removed along with water and other waste in the form of urine. Now the definition. The urinary system, also known as renal system or urinary tract, consists of the kidneys, that are there is two kidneys, ureters, there is two ureters, bladder and one urethra. The urinary tract is the body's drainage system for the eventual removal of urine. In this picture you can see that there is two kidneys, then right kidneys and left kidneys, two ureters, one urinary bladder and one urethra. Next, we will know about the function of urinary system. First, removal of waste products from the body, that is urea and uric acid. Second, regulation of electrolyte balance, that is sodium, potassium and calcium. Third, regulation of acid-base hemostasis, and the fourth one is controlling blood volume and maintaining blood pressure. Now we will know about the kidneys. The kidneys are two bean-shaped organs found on the left and right side of the body in vertebrates. They are located at the back of the abdominal cavity in the peritoneal space. The kidneys are located high in the abdominal cavity, one on each side of the spine, and lies in a retroperitoneal space at a slightly oblique angle. The asymmetry within the abdominal cavity caused by the position of the liver typically results in the right kidney being slightly lower and smaller than the left, and being placed slightly more to the middle than the left kidney. Here you can see the picture of a kidney. This is a dissected kidney. The relationship with other organs of kidney. First, the right kidney, it is anteriorly related to duodenum, hepatic flexure of the colon and right lobe of the liver. In this picture you can see that the right kidney is located related to the liver and the hepatic flexure and duodenum. Posteriorly, it is related to the muscles of the posterior abdominal wall, and superiorly the right adrenal gland. There are two adrenal glands. One is on the right kidney and one is on the left kidney. So, superiorly they are related to adrenal glands. Next, the left kidney. Anteriorly, the spleen, jejunum, splenic flexure of the colon, pancreas and stomach. Here you can see that spleen, splenic flexure of colon, jejunum, pancreas, stomach. Posteriorly, muscles of posterior abdominal wall, and superiorly left adrenal gland. Next, we will know the structure of a normal kidney. The normal kidney length of the normal kidney is about 11 cm or 4.3 inches. Next, the width of the kidney is 5 cm and the thickness is 2.5 cm. Weight of the kidney, that means a male right kidney is about 125 grams and the left kidney is 175 grams, and a right female kidney is 115 grams and the left kidney is 155 grams. The left kidney is approximately at the vertebrate level T12, that means thoracic 12 to L3, lumbar 3, and right one is slightly lower. The kidney is a bean-shaped structure with a convex and a concave border. In this picture, you can see that this is the convex border and this is the concave border. The kidney is a bean-shaped structure with a convex and a concave border. The kidney is divided into two major structures, the outer cortex and the inner medulla. In this picture, you can see that this is the inner medulla and this is the outer cortex portion. This portion is called the outer cortex portion. A recessed area of the concave border is the renal hilum, where the renal arteries enters in the kidney and the renal vein and urethra leaves. You can see that this area is called hilum of the kidney. You can see that there the renal arteries and the renal veins enters in the kidney and the renal pelvis leaves the kidney. Okay. Next, the renal pelvis is the flattened area funnel shaped expansion of the superior end of the ureter within the renal sinus. The pelvis is divided into two parts called major calyx, and each major calyx divided into number of minor calyx. The superior border of the ureter, this area is called renal pelvis, and this renal pelvis is divided into major calyx, and this major calyx are further divided into minor calyx. Okay. These structures take shape of 8 to 18 cone-shaped renal lobes, each containing renal cortex surrounding portion of medulla called a renal pyramid. You can see there are 8 to 18 cone-shaped area. This area looks like a pyramid. These are called renal papilla of pyramid. Okay. Next, the nephron. The nephron is the microscopic structure and functional unit of the kidney. It is composed of a renal corpuscle and renal tubule. This is the picture of a nephron. The nephron is mainly composed of renal corpuscle, that is also called Malpighian corpuscle, and this whole area is called renal tubule, that means the collection of tubes. It is composed of renal corpuscle and renal tubule. A healthy kidney has 0.8 to 1.5 million of nephron in each kidney. The renal corpuscle consists of a tuft of capillaries called glomerulus and a encompassing Bowman capsule. Here you can see this area is called the glomerulus. Here is tuft of capillaries, and the encompassing area is called the Bowman's capsule. Afferent arterioles form a tuft of high pressure capillaries about 200 micrometer in diameter. After passing through the renal corpuscle, the capillaries form a second arteriole, the efferent arteriole. Here you can see a tuft of arteries are made by the afferent arterioles, and they are then leaves the glomerulus by the name of efferent arterioles. All the renal corpuscles as well as both proximal convoluted tubule and distal convoluted tubule are found here. This is the proximal convoluted tubule, that means this area, and this area is called the loop of Henle, and this area is called the distal convoluted tubule. Some nephrons have a short loop of Henle that doesn't dip beyond the cortex. Next, we will learn about the ureters. As the urine forms, it drains into the calyx of the kidney, which merges to form a funnel-shaped renal pelvis in the hilum of each kidney. The hilum narrows to become the ureter of each kidney. As they approach the bladder, they turn medially and pierce the bladder wall obliquely. You can see in this picture that the renal pelvis is shortened and narrowed and then called as ureters, two ureters, and they pierce the bladder obliquely. These two ureters collect urine from the kidney and collects it in the bladder, passes it to the bladder. It is important because it creates one-way valve that allows urine into the bladder but prevents reflux of urine from the bladder back to the ureter. Muscle layer of the ureter consists of longitudinal and circular muscle that create the peristaltic contraction to move the urine into the bladder without the aid of gravity. The ureters are approximately 30 cm long. The next one is the urinary bladder. The urinary bladder collects urine from both the ureters. The bladder lies anteriorly to the ureters in the female, posteriorly to the pubic bone, and anteriorly to the rectum. Volume in adult can range from 0 to 600 ml. The external feature of urinary bladder. The main body of the empty bladder is pyramidal, having an apex and a base. Lowest part of the bladder is called the neck. You can see this is the picture of a bladder. This part is the base and this part is the apex of a bladder, and the lowest part is called the neck. Okay. Interior of the bladder. The greater part of the mucosa shows irregular loose attachment to the muscular coat. The interior of the base of the bladder prevents the triangular area, the trigone, where the mucosa is smooth due to its firm attachment. This area This area is called the trigone of urinary bladder. Internal urethral orifice is located at the apex of the trigone. Structure: the wall of the urinary bladder consists of the three layers: an outer serosa, a thick coat of smooth muscle, and inner mucosa layer. Next, we will learn about the urethra. The urethra transports urine from the bladder to the outside of the body. The urethra is the one urogenic organ that shows difference in male and female. That means it is the only only urinary organ that shows difference in male and female. Female urethra. The external urethral orifice is embedded in the anterior vaginal wall, inferior to the clitoris and superior to the vaginal opening. The length is 4 cm, and for male urethra, it passes through the prostate immediately inferior to the bladder before passing below the symphysis pubis. And the length of male urethra is 20 cm. Here you can see in this picture embedded below the clitoris. This is the clitoris, and superior to the vaginal opening. This is the vaginal opening, and medial to the labia minora. Okay, and for the male urethra, here is the prostate. It passes through the prostate like this, and this path is long and it is 20 cm in length, and the female urethra is 4 cm in length, and this is the major reason and significant reason for females UTI, that is urinary tract infection. So thank you so much for listening. If you like my videos, please subscribe the channel for more updates. Thank you.